When I was a new nurse, I always wanted to work at the hospital because of the 12-hour shifts, but you only working 3 days a week. I applied to a few hospitals in my area, but due to my inexperience, I wasn't getting hired anywhere. During the interview process, I was up against those with at least 6 months to a few years of experience in a hospital or short-term care setting. I ended up working at a nursing facility to gain some experience. After my 3 months of training at the nursing facility, I started my journey as a new independent nurse on the night shift. It was a requirement that every shift had at least one registered nurse in the house. The others were licensed vocational nurses. Therefore, whenever a patient expired in the facility, only a registered nurse could confirm or pronounce that the patient had died. There were 4 wings in this nursing facility, and I worked in a wing with both long-term and short-term patients. I was a new nurse, working with several licensed vocational nurses who had 5 to 10 years of experience over me, but I was in charge of them. I'm sure that all of them could pronounce an expired patient, but it was required that a registered nurse did that part. One night, a patient expired in the other wing, and I was asked to go, assess the patient, and confirm that the patient had died. It was my very first time, and I was scared. I remember walking into this patient's room. The staffs had kept the temperature in the room low, so it was cold the moment I walked in there. The patient was in bed in a semi-Fowler position with the head of the bed at a 45-degree angle. He was pale, with his eyes and mouth wide open. I stood a few feet from the patient and observed his chest. There were no signs of him breathing. I stepped closer to check his radial pulse. My left hand was holding his index and middle finger, while my right hand was checking for his radial pulse, and suddenly his hand, which I was holding, started closing. I felt the movement and got scared, so I stepped back and rushed out of the room. The LVN named Candace saw me and asked if I was okay. I said I was, but asked if she could go in and check the patient with me. Candace was an older LVN who had been working there for 12 years, so she was very experienced. We both went in, and I was able to listen to the patient's chest and notice there were no heartbeats. We did a thorough assessment to confirm that the patient had expired. I continued to work in this nursing facility instead of trying to work at the hospital, as I was beginning to gain more experience and getting comfortable with the people I worked with. There was this patient in the room right across from the nurse's station, and she requested that her room be closed all the time because of the commotion at the nurse's station. Let's call her Margie. Margie was an 83-year-old patient who had lost her husband a few years before coming to the nursing facility as a long-term patient due to her inability to do most activities of daily living. Margie was a very kind patient, and her daughter would often visit her and ask her to go live with her daughter. However, Margie kept refusing to go and live with her daughter. I remember asking Margie about it one evening while doing my med pass. According to Margie, she would love to live with her daughter and watch some of her grandchildren and great-grandchildren. However, she did not want to be a burden to them. Living with them would be nice, but the thought of being a burden to them wouldn't give her any peace of mind. She was a very thoughtful and considerate person. One night at 9 p.m., I went into her room to give her some meds. Margie asked me if I could convince her doctor to allow her to have 1 cup of wine every night, because that's what she usually drank before bed when she still lived at home. According to Margie, a cup of wine helped her sleep better at night. I told her that I would bring it up with her doctor whenever he came by. But since I worked at night, and the doctor usually made their rounds in the morning, I suggested that Margie bring it up with the doctor if I wasn't there when he did his rounds. The following week, one night Dr. P came in at 10:45 p.m. I had just come on shift, and the swing shift nurse had just left. I didn't know why Dr. P was rounding on his patients so late that day. He must have been very busy or something. I saw Dr. P go into another patient's room. Then suddenly the call light outside Margie's room turned on, indicating she needed help. I went in to help Margie. I helped her get up to use the toilet, and then when she was done, I assisted her back to bed. As I was covering her with her blanket, Dr. P walked in. Dr. P greeted Margie and checked on her, and as he was listening to Margie's lungs, she asked, "Dr. P, can I have a cup of wine every night before bed? I used to, and it helps me sleep better." "No. You have high blood pressure and some other issues," Dr. P answered. Then he stopped listening to Margie's lungs, took off his stethoscope, looked at me, and said, "You know what? Why not?" Dr. P then smiled, looked at Margie, and said, "I'll write an order that says it's okay for you to have 1 cup of wine before bed every night, but make sure your family brings you the best wine they can find." Without asking Dr. P why, I just knew why he was okay with Margie drinking a cup of wine before bed. We work in the medical field and follow every book and guideline there is to follow. However, we must not lose the human side of us. If Margie were my family member, I would bring her some wine. Fast forward 7 months later, I switched over to working the swing shift. Margie started having some bradycardia episodes where her heart rate would drop into the 30s. She did not want anything done, and stated that she would rather go when it was her time, because she missed her husband. One day, I went back to work after proposing to my girlfriend the day before. Some of the CNAs that worked in our facility knew about it, and I guess one of them told Margie. When I went to Margie's room to give her meds while she was having dinner, she told me that she heard about the good news. "Young man, I would like to have a toast with you, but you're at work, so you can't have alcohol. But congratulations." I joked about it, but kindly thanked her for the wonderful words. That night around 10 p.m., the CNA was making her rounds, going from room to room to fill up the patient's ice water and make sure the rooms were nice and neat. One of them went to Margie's room and then came right out while I was charting at the nurse's station. This CNA reported to me that she thought Margie had died. I got up and ran into Margie's room and found her in her bed with the blanket up to her abdomen. Her eyes were closed as if she were sleeping, but her face was pale white. She was unresponsive. There was no pulse, and she wasn't breathing. I listened to her heart, and there was no heartbeat. On her nightstand was her cup of wine, half drunk. After a thorough assessment, I concluded that the patient had expired. I came back out and made calls to notify the doctor and the family and get some paperwork going. Margie had a DNR, do not resuscitate order, so we just left her alone when we found her like that. At 10:30 p.m., the night shift nurse Abby arrived. After giving Abby the reports about the unit, I told her about what happened to Margie. I told her how it was such a shock to me because Margie had just been talking to me about my proposal to my girlfriend, and she seemed fine. I didn't think she was going to pass away. After I gave the report to Abby, I poured some Dr. Pepper soda into a little medicine cup and went into Margie's room. I remember standing there looking at her, and then touching her cup of wine with my little medicine cup as if having a toast. And then I took a shot of soda. After that, I came back out to finish the rest of the paperwork for the morgue transporter, who would be coming in soon. After about 30 minutes, I finished the paperwork and left it at the nurse's station for Abby to give to the morgue transporter. I got up, grabbed my stuff, clocked out, and was about to head out when the morgue transporter arrived at the door. He came in with his metal gurney and walked over to Margie's room. He had been there plenty of times, so he knew where Margie's room was. I followed him to Margie's room but stood at the door, watching him pull Margie onto his metal gurney. Then I noticed that the cup of wine in Margie's room was now empty as if someone had drunk it. I knew it wasn't the morgue transporter since I had followed him to Margie's room. The whole time, Margie's room had been closed, and since it was right across from the nurse's station, I hadn't seen anyone going into her room since the last time I went in. I felt chills and like spiders crawling all over me. I left for my car and drove back home. I have no idea who drank the wine. As a person with a strong belief in the paranormal, I kept imagining Margie getting up to take one last drink because I went in there and did a little toast. To this day, I still don't know and have no explanation as to how, why, or who could have drunk her wine. One day, a 94-year-old patient was admitted to our facility from the hospital. The patient's family wasn't able to adequately take care of her at home anymore due to her health issues. Therefore, they decided that a nursing facility was their best option. Let's call this patient Joyce. Joyce was a healthy 94-year-old who didn't have many medications. One thing I've noticed with our 90-year-old patients compared to the 60-year-old patients at the nursing facility is that the 90-year-olds hardly have any medication. Maybe a blood pressure pill, a fish oil supplement, and a vitamin pill. That's about it. Maybe they live to be 90 due to their very healthy lifestyles. Anyway, Joyce was forgetful sometimes, but she was a very kind person. Her daughter Emily, on the other hand, could be very hard to deal with. While Joyce was there, the aides who took care of our patients at the bedside had to rotate. Usually, the aides preferred their own group, or the group of patients they were familiar with. However, every day, a new aide would have to be assigned to take care of Joyce, due to the hardship of having to deal with Joyce's daughter, Emily. One evening, an aide came over to me at the nurse's station and said, "Joyce's daughter is here and would like to talk to someone in charge." I told the aide that I would be there once I was done faxing some new orders to the pharmacy. I let Joyce's daughter wait a little longer since patient care was my priority. Once I was done giving some antibiotics to my patients, I headed over to Joyce's room and saw Emily standing outside holding something. When I got there, she held up a strawberry ice cream to me and said, "What is this? Can you tell me what this is? You guys know that my mother is diabetic, and you put a regular ice cream in her dinner tray? What kind of place is this?" I looked her in the eyes and told her that I was sorry. I took the ice cream from her, walked into the room, opened the ice cream, and gave it to Joyce. I asked Joyce if she liked strawberry ice cream, and her eyes lit up in excitement. "Oh yes, they're my favorite." I put the ice cream on her dinner tray and told her to enjoy it. Then I asked Emily to follow me to the family lounge since no one was in it. I said to Emily, "If she loves strawberry ice cream, you should bring her some more. Joyce is 94 years old and has a poor appetite. She is at high risk for low blood sugar. Based on her blood sugar records, her sugar has dropped into the 50s and 60s many times. I understand she's diabetic, but it's okay for her to have regular strawberry ice cream. Your mother is 94 years old. Just bring her whatever she likes to eat. She's here in our facility, and we'll monitor her blood sugar closely." When I talked to Emily, it was as if something had finally snapped, or like she suddenly came to an understanding. She started to apologize for treating the staff harshly. Emily broke down and said she had been stressing out about her mother's health and felt guilty for putting her in the nursing home, as she had promised her father to take care of her mother before he passed away. Emily was their only child, so she's always feeling some kind of pressure when it comes to taking care of her mother. After my little conversation with Emily, she became nicer and a little more appreciative of our staff. A few weeks later, one evening, I was passing meds to my patients, and when I got into Joyce's room, she appeared as if she had been crying. I asked her if she was okay, and she said her daughter, Emily, had just stopped by and didn't say anything to her before leaving. I asked Joyce when Emily stopped by, and she said just now, but Emily had just left. I thought Joyce was just being forgetful as usual. I was in the hallway this whole time, passing meds from room to room, and I didn't see Emily coming in or going out. Right around 9 p.m., about 8 of Joyce's family members came by and went into her room. I heard some crying and sobbing, so I went to check if they were okay. That's when I found out that earlier, Emily had gotten into a car accident and was rushed to the hospital where she later died. Shortly after that, Joyce's health began to deteriorate, and she stopped eating altogether. During the time when she was very sick, Joyce mentioned many times seeing Emily coming by to see her and holding her hand at night. The family didn't want Joyce to have a feeding tube since it would just cause more pain and prolong her suffering. She eventually passed away. Being a nursing staff member working in a nursing home or nursing facility is not easy. We've seen patients come and go all the time. We've grown attached to these patients. Each time our aides would end up crying with the family members of the patients who had expired. Sometimes, we nursing staff are all that the patients have. There's no family, or often, the family members are out of town or in a different state. That's all for this video. Thank you for making all the way through and supporting my stories. Have a wonderful day or night.